Hi, I'm James Stuckey. In part 1 of this video, we covered a number of the most common spinal pathologies you will encounter. In this second video, we will review the remaining most common spinal pathologies. I'll begin with spinal listhesis. Listhesis is defined as an abnormal movement or slippage between one vertebra and another as a result of instability. There are 3 types of listhesis. Spondylolisthesis, which is the forward displacement of the superior vertebral body over the inferior adjacent vertebral body. This is the most common form of listhesis. Retrolisthesis is the backward displacement of a superior vertebral body over the inferiorly adjacent vertebral body. And lateral listhesis is the lateral displacement of a superior vertebral body over the inferiorly adjacent vertebral body. I'm going to take a deeper dive into spondylolisthesis, since it is the most commonly seen listhesis. There are 4 grades of spondylolisthesis. The amount of forward displacement, or subluxation, determines the grade of the spondy, as it is commonly referred to. Grade 1 is 0 to 25% slippage, grade 2, 25 to 50%, grade 3, 50 to 75%, and grade 4 is 75 to 100%. Spondyloloptosis describes a scenario in which the spine is more than 100% displaced, essentially falling off the top of the segments below. Another pathology that shares the Latin prefix of spondy is the term spondylolysis. This pathology is defined as the fracture or defect in the pars interarticularis of the vertebral arch. This pathology is more commonly referred to as a pars fracture. Such a fracture destabilizes the spine and can lead to spondylolisthesis if untreated. Now I'll move on to the other spinal fractures. Spinal fractures are typically a result of high-impact events, such as a motor vehicle accident or sports. The most common fractures of the spine occur at the junction of the rigid thoracic spine and the very mobile lumbar spine. Spinal fractures are classified as the following. A chance or seatbelt fracture is when the vertebra is literally pulled apart or distracted. It consists of a tension failure injury to the anterior column of the vertebral body and the transverse fracture through the posterior elements of the vertebra and the posterior portion of the vertebral body. A fracture dislocation is an unstable injury involving bone and/or soft tissue in which a vertebra may move off an adjacent vertebra or is displaced. These injuries frequently cause serious spinal cord compression. A burst fracture is a type of compression fracture due to high-energy axial loading, such as falling from a height and landing on the feet or seat. This results in loss of vertebral body height on both the front and back sides, with possible retropulsion of bony fragments into the spinal canal, risking neurological impairment. And finally, a compression fracture is when the anterior vertebral body breaks and loses height, while the posterior part of it does not, commonly as a result of osteoporosis or other bone weakening conditions. While it can be painful, this type of fracture is usually stable and rarely associated with neurologic problems. Spinal tumors can also be encountered. While they can be primary tumors, it is more common for the tumors in the spinal region to be secondary or metastatic, meaning they have spread from another part of the body. Treatment of spinal tumors involves removal, typically via a corpectomy, followed by radiation and/or chemotherapy once the patient has recovered from the surgery. I will just briefly describe scoliosis in this video, as a true understanding of it requires a much more in-depth discussion. Scoliosis as a general term describes a curvature of the spine in the coronal plane of 10 degrees or more. There are many causes of scoliosis, but there are 4 main types. Congenital scoliosis, or abnormal coronal curvature due to the malformation of the spine occurring before birth. Neuromuscular scoliosis, which results from a neurologic or muscular disease. Adult degenerative or de novo scoliosis, which an abnormal coronal curvature acquired as an adult due to progressive degenerative changes in the spine. And idiopathic scoliosis, or scoliosis from an unknown cause. It can be further classified by age. Early onset scoliosis, or EOS, refers to that in children 10 years or younger. EOS can be further defined as infantile, representing ages up to 3 years, and juvenile, referring to children from 4 to 10 years of age. Adolescent scoliosis refers to that in children greater than 10 years old. And that's it. While part 1 and part 2 of this video are not entirely exhaustive of every type of spinal pathology, we have covered the most common you will encounter.